Well, now that we've refreshed our memories from history class on the Spanish flu, we'd like to welcome back Dr. Michael Sweat. He is leading MUSC's COVID-19 Epidemiology Intelligence Project. He is also professor and director at MUSC's Center for Global Health. It's great to have you back.
Thank you. Good to be here.
So a lot of similarities between how the Spanish flu and COVID have affected society. Maybe you can talk a little bit more about the pathology of the two and whether or not there were any similarities.
Yeah, there were some similarities, but a lot of differences as well. Similarity-wise, there were waves of infection that occurred with the 1918 flu epidemic. And kind of remarkably similar, there were several waves that occurred, 3 distinct waves that occurred over the first 2 years, which is similar to what we've had with COVID as well. And as well, it got worse as it progressed in the 1918 epidemic. But there were some significant differences as well. For one, it's the flu, which is a different family of viruses than coronaviruses, which we're dealing with COVID. And secondly, the type of people that were affected were very different. The most vulnerable people with COVID are older, and the most vulnerable people with the flu epidemic were younger. In fact, a statistic I saw was up to 10% of working age people during the flu epidemic in 1918 died from the flu. So it really affected a very productive group of people. As opposed to this current epidemic, which is affecting older people.
What do you think could have been done had they had the knowledge, the technology back in 1918 to stem either the flow or the symptoms of the Spanish flu?
Yeah, well, for one thing, today we have antivirals like Tamiflu, which helped tamp down the replication of the virus, and those weren't available at the time. Testing, there was no way to test for the flu at the time, so nowadays with testing, you're able to isolate people much quicker, so it helps control the contamination. We have higher quality masks, such as N95 masks, and in those days, they used cotton, heavy cotton type masks that they constructed. So, you can go on and on. We now have the capacity to ventilate people. We also have advanced respiratory therapy techniques, and not to mention vaccines. We have vaccines now, and there was no vaccine at the time for the flu.
Very interesting. There's something called the cytokine storm, and it's been referenced to the Spanish flu as well as to COVID. What is it exactly?
Yeah, cytokine storm is really your body detecting an invader, and it puts all hands on deck to try to get that infection under control, but it overreacts. And when it overreacts, it leads to a form of shock, really, that can be quite deadly. And for example, with COVID-19, it's been learned that you can use steroids to tamp down that inflammatory reaction and save lives. So that's one of the frontline treatments for people who end up in the hospital, is to get them on a heavy steroid dose. And again, back in those days, artificial steroids had not been discovered, and it was not well understood. So that is another similarity between the two. And they're both types of pneumonia that has mostly killed people with COVID, and the flu also generated a very strong type of pneumonia. So those are also very similar.
Now, COVID aside, could society ever experience another flu pandemic again? I mean, considering that we do have these Tamiflu and certain viral medications and things like that, knowing that viruses are so very intelligent, do you think that it is at all possible?
Oh, absolutely. It's one of our biggest worries. In fact, most of the planning for a large-scale respiratory type outbreak pandemic was really geared around the flu, because that has historically been what has flared up at times. We get variants of the flus from year to year that are quite serious. Yeah. So most of the thinking and planning was really filtered through thinking about the flu, and it actually led us in many ways down the wrong path. So earlier on, issues around masking, for example, were really the resistance by a lot of the experts to using masks were because the flu is transmitted by droplets, and it became discovered later that COVID is really transmitted more by aerosols.
Yeah.
So the flu is a concern, continues to be a fear, and it has definitely affected our strategy towards COVID as well.
Very interesting. That's very interesting. And of course, in terms of how long it's going to take for COVID to end, we're not out of the woods yet. Can't really draw those comparisons to Spanish flu because they are two very different diseases. But Dr. Sweat, I want to thank you so much for joining us today.
My pleasure. Thank you for having me.
We're back after this.